This is Caring for Kids on News Talk 760 WJR, presented by the Children's Hospital of Michigan Foundation. And here's your host, President and CEO of the Children's Hospital of Michigan Foundation, Larry Burns.
Thanks, Mark. Hello, everyone, and welcome to Caring for Kids 2019. Tonight we have a special show. It's focused on international health and safety, highlighting three guests who are involved with an upcoming International Patient Safety Symposium to be held on February 8th at St. Clair College in Windsor. Tonight we're joined by, in the studio, Bill Marra, Vice President of External Affairs and Executive Director of the Changing Lives Together Foundation, Hotel de Grace Healthcare in Windsor. Dr. Ken Blanchette, Associate Vice President Academic from St. Clair College, and Dr. Rudy Valentini, Group Chief Medical Officer for the Detroit Medical Center and Chief Medical Officer and Pediatric Nephrologist at our very own Children's Hospital of Michigan. And it's all coming up next on Caring for Kids, here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Welcome back, everyone. Larry Burns here for Caring for Kids, January edition, and my first guest in the studio is Bill Marra. Bill, who carries both a Canadian and Italian citizenship, was born in Switzerland and immigrated to Windsor at the age of 3. Bill attended W.D. Lowe Secondary School in Windsor and obtained his Bachelor of Arts degrees in both sociology and then criminology from the University of Windsor. Bill spent 6 years with the Ministry of Correctional Services as a probation and parole officer. He was the 14-year executive director of New Beginnings and then has also held the position of president and executive director of the Hotel de Grace Hospital Foundation. Bill, welcome to Caring for Kids.
It's a real pleasure to be here. Thank you, Larry.
Great to see you. And for our American listeners who don't always know what a secondary school, that is your version of high school, correct?
That's absolutely correct.
That's right. Good. So, and all my Canadian friends say university versus college, so I'm all used to that. So, growing up in Detroit and spending a lot of time in Colchester and Kingsville, I feel like I'm a secondary Canadian citizen. So,
very good.
Welcome. So, most importantly, let's start off by telling me about your current position and how you became involved with the International Patient Safety Symposium.
Well, a significant responsibility that I have is related to external affairs and partnerships. I'm also the executive director of our foundation, so it's very, very common for me to work with partners in a number of collaborative capacities, and we certainly enjoy our relationships with our American friends here in the greater Detroit area. Regardless of how these healthcare systems are structured or funded, it's no surprise to many of your listeners, I'm sure, that the challenges are quite similar with aging populations, geriatric challenges. Folks are living longer and dealing with healthcare issues on a far longer and greater basis. We're dealing with significant mental health and addictions issues. We're certainly dealing with challenges related to opioids and crystal meth in our community. So you really, when you look at North American trends, they're very, very similar, regardless of where the borders line up. And so this is an opportunity for us to share in some important dialogue around patient safety. And, we often talk about the twin nation strategy associated with Windsor and Detroit. It's often associated with tourism and hospitality, but healthcare is important to everyone. It's a common denominator in everybody's lives. So we're really thrilled to be doing something of this nature and sponsoring it and hosting it in Windsor.
Great. Well, I'm excited and honored to be involved as a panelist. So I look forward to it very much. And we're talking with Bill Marra, Vice President of External Affairs, Executive Director of the Changing Lives Together Foundation, and also President and Executive Director of the Hotel de Grace Hospital Foundation. And so you mentioned several things that our Children's Hospital of Michigan Foundation are very involved in as it relates to young adults and opioids particularly, and also with families as it relates to all sorts of different issues. And so even though our focus is on children and families and young adults, the aging population also impacts us as well, as more and more baby boomers are caring for aged parents. that impacts how they deal with their families and children as well. So all of those things, as you mentioned, are very relevant to us, not only here in Detroit, but also our foundation. Can you talk a little bit about some of the current challenges that healthcare providers and some of the key initiatives regarding safety standards? Has anything changed in the recent years, or things evolving that maybe are new to the scene?
Well, some of the challenges continue to be consistent with what many healthcare providers have dealt with for years. So, for example, infection control might not seem like a big deal to most folks, but it is, and it certainly can be a life or death situation if not managed properly when the patients are admitted into hospital. And in our case, we're a post-acute care hospital, Hotel Dieu Grace Healthcare, so we have longer stays, Larry. We deal with complex medical care, rehab patients, brain injuries, spinal cord, long-standing mental health issues, so we have a specialized mental health program. So when folks are staying in the hospital for 30, 35 days, 40 days, infection control is a critical aspect of it. Medication, administration of medication and monitoring medication continues to be a challenge around patient safety. But I'll offer a bit of a different lens as it relates to patient safety. Good. One of my responsibilities is security. And in the day and age that we live in, you have to approach security quite differently. We're on a 33-acre campus. We have 7 buildings, about 800,000 square feet of floor space, 1,300 employees, 500 volunteers, 800 students a year, 100,000 outpatient visits a year. So we prepare for the most incredible of circumstances. We have an active shooter policy. We're in the process of ordering and equipping every staff with something called a personal alarm system. So if you activate it, it has a GPS technology where safety and security is paramount. They know where to find you, how to find you. The security personnel will have their picture come up on the screen so they know who they're looking for. We're even going in-house with our security because we believe our security personnel could be part of the patient care team. And so patient safety is not only about the clinical aspect of it, it's the physical safety for our patients, for families and visitors. And the reality is at times we deal with patients who are perhaps dealing with addictions or mental health issues, or perhaps even a brain injury where they're not being themselves. And it creates a risk for visitors, for staff, and for patients. So patient safety takes on a bit of a different approach in that respect.
Absolutely, and that's extremely important. And I think we can, when we stop and think about that, we can relate it to safety everywhere we go now is different than it was maybe 5-10 years ago. And then you put it in an environment like you explained with all the issues going on regarding patient care and mental health and other things, that your challenges for patient safety, family safety, visitor safety is enormous. And it sounds like you are leading the way in what needs to be done in hospitals in Canada, and we can learn a lot from you as well. And so, Bill, anything else you want to mention about your position or about the symposium before we let you go?
Maybe to close out, just encourage folks that are able to attend to take the opportunity. There's a lot that we can learn from each other. The reality is there's some best practices and evidence-based practices and approach. We can learn a lot from reading and research, but the best opportunities are through the networking that we have through frontline staff on both sides of the border. We are very proud of the work we do. We're impressed with the work that happens here in Michigan with many of the hospitals, and the symposium lends itself to that opportunity for dialogue. We're going to have outstanding panelists. We're thrilled that you're going to be there as well.
Thank you.
And it's an opportunity to learn and create relationships that could be long-standing between both sides of the border.
Great. And Children's Hospital has a long history with folks in Windsor, both patients, nurses, physicians, and so that will continue. And just so everyone knows, I'll mention again, it's the International Patient Safety Symposium. It's scheduled for February 8th at the fabulous St. Clair College in Windsor, Ontario. So, Bill, thank you very much for joining us. I look forward to seeing you in Windsor next time and continuing the conversation.
Thank you, Larry.
Thank you. That was Bill Marra, Vice President of External Affairs and Executive Director of the Changing Lives Together Foundation. And when we return, we're going to have Dr. Ken Blanchette, Associate Vice President Academic from St. Clair College, when Caring for Kids continues here on the great voice of the Great Lakes. News Talk 760 WJR.
Welcome back to Caring for Kids on WJR, presented by the Children's Hospital of Michigan Foundation.
Dr. Ken Blanchette is the Associate Vice President Academic for St. Clair College. He joined the college as chair of the School of Health Sciences in 2010 and has played an important role in establishing collaboration with local hospitals, allied health professions, nurses, and physicians throughout his career. Dr. Blanchette has a Doctor of Chiropractic and a Bachelor of Science in Human Biology from the National University of Health Sciences in Lombard, Illinois, and a Bachelor of Science from the University of Windsor. Dr. Blanchette, welcome to Caring for Kids.
Oh, thank you for having me.
Great to have you in the studio. And so, just in case people aren't terribly familiar with St. Clair College, can you tell us a bit about St. Clair College?
Yes, I can. So it's a community college in Windsor, and we have a variety of academic programs there, about 130 programs at the college, of which when I first started there, I oversaw the allied health and the nursing programs. And we currently we're in a very large growth phase, actually, for the college. We grew by 20% in the last year. We're about a little over 13,000 students. We've been able to increase our reputation internationally. We've had quite a few international students as well coming through. And what we are known for in the healthcare world, especially in the province of Ontario, is we graduate the largest number of healthcare practitioners out of all the educational institutions in the province.
Terrific. And a lot of those, I assume, are going into allied health professions.
Yes, allied health, nursing professions, and we have a strong partnership with our University of Windsor and University of Western School of Medicine, Schulich.
Sure. Yep.
We do a lot of work with them as well.
So I spent a number of years at the Medical College of Ohio, which is now the University of Toledo, and we had a School of Allied Health, so I was very familiar with the great programs and how hard it is for those students to excel. So I'm sure your students work very, very hard to get their degree.
Yes, sir, they do.
And so how does healthcare education, since you're in the education part of that, how does patient safety fall into the education process? Is it an important part of the curriculum for students today?
Absolutely. It's actually a very complex process for the educational piece. So one of the most important aspects is to make sure that everybody that's going through one of the programs is educated to the most current standards, right? And there's a lot of safety checks along the way for that process in the education. So not only do we test our students academically, on paper, but we also have a very rigorous testing when it comes to the performance. So the physical performance, a lot of the skills, or a lot of the lab tests that they're doing, those are also assessed within our program as well. And what we have done at the college in the last 10 years is we've built a 100,000 square foot simulation center. It's purely simulation. There's no classrooms in there. And we are allowing our students to actually put in more time to understand the concepts, to practice their skills so that it becomes more of a habitual thing. And when you can get a student to graduate after performing these skills over and over again, that's where patient safety comes in. They're not second guessing what they're doing. They can respond quicker.
Second nature.
That's right. That's what we're looking for. And not only are we looking at the skills, we're looking at the personality interaction with the patient. It's very important for any patient when they're being taken care of that they feel that they are being taken care of by the right person.
Right.
Right.
And that's so important.
Absolutely.
And I remember during my my tenure involved in communications and marketing at now the University of Toledo Medical Center, how important it was to just a simple thing like washing your hands before you go into a patient's room, doctors, nurses, everybody. And you would think that would be easy to communicate, but to people who weren't used to it, like you are providing in your educational process, so it becomes second nature. It was a real challenge.
Yeah, absolutely.
And so you're doing great work there. We also tried to mimic a little bit the airline industry because of the things that they do as it relates to safety and checking, and it becomes very routine.
I'm glad you actually mentioned that because it's something we talk to about our students all the time. And it's that perception, right? And what we do is we actually videotape our students when they're doing scenarios, and they look back and they do peer-to-peer assessment of one another, and they look back on themselves. And I always give them the example of, if anybody here has ever played a sport, they say yes. So we're all legends in their own mind until we see a videotape of ourselves doing it, and then we realize, oh my goodness, that's what I look like.
Right.
And that's where we can teach them the body language and communication they will have with the patients is just as important as the word language and the performance of skills that they're doing in front of them.
Yeah, absolutely, just as important. So now this symposium that you're involved in is sort of bringing together, not sort of, it is bringing together people from Canada and people from the United States. And so this cross-border integration, how important do you think that conversations will be during the February 8th symposium?
This is one of the most critical things I think we can have. With the United States and Canada, we have the highest level of healthcare and healthcare education, I think, in the world. Detroit and Windsor are at such a unique crossroad where we can actually lead both countries in sharing of best practices, of sharing, patient care, responsibility, outcomes, so that it's all about the patient and the population and the vulnerable sector, the people that need our help. And if we can share that between two countries and pave that way, and the conversations of the past symposiums we had have been incredible. The sharing of stories, best practices, and there's a lot of our graduates that come and work here in the U.S.
Oh, I know. A lot of Children's Hospital, the nurses, and other providers.
It's fantastic that we have that, right? And there's other opportunities for innovation. And that's the other big piece that I'd like to see come out of these things, conversations about innovation. How can we further push our healthcare system to make it more efficient, to really not deal with so much more acute care, but how do you prevent? Right? Prevention is the biggest key that's going to help not only the patient, but even our economy financially.
Absolutely. Well, it's such a big part of the economy. We're talking with Dr. Ken Blanchette, Associate Vice President Academic from St. Clair College across the Detroit River. Are you getting involved at all? It's something that the foundation is now involved in the social determinants of health. And we joined an international organization called the Root Cause that sort of concentrates on that. Are you integrating that kind of information in the educational process?
Absolutely, we are. It's actually,
you're smiling.
I'm smiling because I actually sit on the board for the health unit.
Okay.
I sit on the board for Hotel Duke Grace Healthcare, and I'm actively personally involved in a lot of that. So what we have implemented actually in our programs is we're working with the downtown mission, the Windsor Downtown Mission, with the Windsor Essex County Health Unit, and we're actually providing not only care, but educational pieces. How do people prevent? How do people get out of that state so that they can prevent and deal with these social determinants of health? And it's been fantastic. We've actually, one of the ones I'm proud of, it might sound very simple, but our fitness and health program has actually designed a fitness and health program for the folks that are homeless or at the downtown mission so that they can work on getting themselves healthier. Getting themselves more prepared. And then the mission themselves, we're working with them. They're giving them education on how to start businesses, how to do things. And we've seen so many success stories of people getting out of that economic platform and then in healthier. And it's
I'm
all
sure
encompassing.
The physical health leads to better mental health.
Absolutely.
Feeling better about yourself. And,
absolutely.
So in the pediatric child arena that we're involved in, we're very involved now in ACEs and resilience. But I also am very interested in older adults like myself and older, and the things that cause us not to go to the doctor and things like that, and that impacts families as well. So it may not be children directly, but it impacts kids and families. So once again, I'm very impressed that you and St. Clair College are leading the way. Before I let you go, though, if someone's interested in attending, what's the best way to find out more about St. Clair College?
Oh, you can definitely go to the website, stclaircollege.ca, not .com.
Okay, .ca. That's good.
.ca, and especially even for our American students, we do have there's a lot of international growth in there. We do accept a lot of the U.S. students in there, and we have a lot of articulation agreements with some of your institutions just across the border, like Wayne State.
Good.
So they can finish their degree.
Transfer and stuff like that.
Absolutely.
Awesome. So I look forward to seeing you on February 8th. And continuing the conversation well beyond that as our foundation evolves into an international foundation starting in Windsor.
Thanks for having me and sharing our story.
Yes, so thank you very much, Dr. Blanchette. Coming up next, we're going to hear from Dr. Rudy Valentini. He's Group Chief Medical Officer for the DMC and Chief Medical Officer and Pediatric Nephrologist at Children's Hospital of Michigan. That's all when Caring for Kids continues here on the great voice of the Great Lakes, News Talk 760 WJR.
Welcome back to Caring for Kids on WJR. Presented by the Children's Hospital of Michigan Foundation. Once again, here's Larry Burns.
Welcome back, everyone. Larry Burns here, January Caring for Kids. In studio is Dr. Rudy Valentini. Dr. Valentini is Group Chief Medical Officer for the Detroit Medical Center and Chief Medical Officer and Pediatric Nephrologist at our very own Children's Hospital of Michigan. Dr. Valentini received his medical education at the Wayne State University School of Medicine and continued his postgraduate education at the University of Cincinnati Children's Hospital and the University of Michigan Medical Center. Dr. Valentini has written numerous publications, including pieces on hypertension in children, in dialysis in children and adolescents. Dr. Valentini, welcome.
Thank you so much, Larry. Pleasure to be here.
It's great to see you always, and like always to see you. And I'm at Children's Hospital or in the neighborhood. And so you have two roles at least. Well, you have at least three roles, being a nephrologist. But I mentioned the one about the Detroit Medical Center and Chief Medical Officer at Children's Hospital. Can you tell our listeners a little bit about each one of those roles, and so they have a better understanding?
Absolutely. I'm the Chief Medical Officer for Children's Hospital of Michigan and have been since 2011. It's a wonderful role. It's a true privilege to be able to do this. I get to set sort of the safety standards for our hospital. I get to be sort of the name and the face behind a lot of the innovation and new approaches to safety that we take at our hospital. I have planned a quality safety conference at our hospital once a year, actually supported by your foundation.
Yes,
so thank you so much for that.
Happy to do that.
And what we like to do on that day is sort of set the tone for safety for each next subsequent year. This year we focused on a concept called Safety 2. We had a speaker in from Children's National Medical Center, a wonderful speaker. And what we do on that day is we have our frontline staff come with their leader. So historically, we always had the leaders come in and learn about the new safety innovation for the year. And then we realized from partnering with our board that we could get a better impact if we actually had them bring a frontline staff member. So an ER manager will bring a frontline ER nurse to
someone
the
who's doing something
someone who's
every
basically
day.
In the weeds, who's really seeing it. So we feel like it really will have a bigger impact when they go back to work the next day as a frontline staff member.
And tell their colleagues as well.
Yeah, so they basically share. You're not going to believe what they're doing now, and this is the really neat thing. And so we learned this from our board member, Adrian Vito, who shared that Alan Mullally did this at Ford Motor Company.
Okay.
So that when Mullally tried to really innovate and advance the cause, he says, I can't just talk to the leaders. I need your frontline staff to be right here with you. So this has been a fun part of my job at Children's, is to continue to try to drive safety to a higher level and be better tomorrow than we are today. So been doing that for a while, and in the last 6 months or so, I've been the group CMO for the Detroit Medical Center. So now I get to take a bigger scope of the entire medical center and partner with physician and nurse leaders, again, driving safety. So that's sort of the big message, both at the Children's Hospital of Michigan and at the DMC level. We focus on reducing hospital-acquired conditions like central line-associated bloodstream infections, which is a fancy way to say when patients go to the ICU, they get big IVs placed to give them medication to support their heart, to keep their blood pressure up, or in some cases to get their blood pressure to go down if it's too high. And these catheters are sort of a double-edged sword. They are absolutely necessary for sustainability of life, but you don't want them in any longer than they need to be. And you want to make sure you're using good infection prevention practices so that you can have low infection rates. That's, I always say, our infection rate and our hospital-acquired condition scores are sort of like your driving record. It's sort of like your credit score. Right. As a hospital, that's how we have our credibility. And if we have good scores and we are deemed safe, we should be able to broadcast that to everyone. And our folks in our community know that they're coming to a safe medical center to get their care. And that's really important for us.
And we're talking with Dr. Rudy Valentini, Chief Medical Officer from the Detroit Medical Center, as well as Children's Hospital in Michigan. And one of the things that I learned when I first got involved with Children's Hospital a long time ago was that caring for a child, particularly a very small child, is very different than caring for an adult. And it's not just minimizing medication because they're little, and so I have to assume that safety, that there's a lot of differences as well. So do you mind spending a few minutes on what issues or what concerns you have when you look at just Children's Hospital versus safety in an adult hospital that like Harper or receiving?
So I think those are excellent points. A lot of the metrics that we use around safety are similar, but the interpretation of the metrics is very different. So we spoke a second ago about central line associated bloodstream infections. So there's a standard by which adult hospitals are measured, and most adults don't need those catheters for very long. However, in children, they need them much, much longer. They might need them for chemotherapy. Mm-hmm. So if a child has cancer, they're going to need that central line for sometimes a year or two. So you can't. So the strategy in adults is to take it out within 7 days so that they won't get an infection. In pediatrics, we can't use that strategy because they need that central line. If the small infant who is not a candidate for what's called an arteriovenous fistula for dialysis, they need the central catheter, and so they might need that central catheter for 2 or 3 years till they can get a kidney transplant. Oh. So caring for children. The strategies that are used to prevent infection in adults are sometimes very, very different in children. So those are just some of the challenges. I think, one of the other parts that makes pediatrics so fun is the integration with the family. So we do so much of that. Our new Children's Hospital of Michigan has private rooms for the neonatal intensive care unit and the pediatric intensive care unit. So now as a clinician who rounds in those places, I get to interact with the family all the time. They're in the room. Right. So they now in the private room, they
sometimes spend the night in the room.
They spend the night in the room, and if in some of the units there's TVs and the families are there and they're engaged and they can relax and they can be close to their loved one instead of being displaced from the bedside. So it gives us a real good chance to interact with the family. So we're using a lot of our prevention techniques around hand hygiene, foam in, foam out. So we do the foam in, which is the alcohol-based foam that we ask people to do before they walk in and out of the room. We're having them have that conversation with families now, too, because they're spending so much time in the room that we need to both model that behavior, but we want to emphasize that behavior because if we believe hand hygiene is important for our patients and our staff, we want to model that so the family does the exact same thing because they're in close proximity to their loved ones, and that's a really important part of what we do.
Yeah, absolutely. And I love the foam in, foam out, so I like that. And so in our previous guest, we were talking about St. Clair College and their allied health educational process for nurses and other allied health professions. And so when they come out of college now, I think they're a little bit more used to foam in, foam out, because in my work career, I've had to try to educate a more seasoned physician on doing that, and that's a little bit more challenging sometimes than somebody who's just coming out of school. So it's a constant something that I know you work on with people.
No question about it.
And so this whole show is dedicated to international safety and the symposium that's coming up on February 8th at St. Clair College. And I know that you're involved, and I also know that Children's Hospital of Michigan has a very long history of being close to people in Ontario, with a lot of nurses that live in Windsor, and our very own Dr. Taub grew up in Windsor. Absolutely. It's just across the Detroit River, and so it makes perfect sense for you and Children's Hospital and the DMC to be involved in this symposium. And what are you hoping to gain from an international dialogue on safety?
Well, it's interesting that you bring that up. I was just speaking with Dr. Blanchette a few minutes ago, and he was telling me how he started a simulation center.
Yeah, I think he said 100,000 square feet.
It's in a very impressive facility, as he describes it to me. And so he tells me how he's been able to create standards of care, whether it be in respiratory therapy, nursing care, physician care, and these are the kind of things that we're learning more and more about at our center. So when we continue to try to advance the safety cause, it comes down to creating standards around standard work. And so that the physicians that put in the central line do it the same every single time. Back to your kind of reference to today's trainee versus somebody who trained 10 or 15 years ago, I think there is a much greater emphasis on safety and on prevention of injury and prevention of complications to the modern trainee. And a lot of them are coming through with a simulation background where they've learned how to do these things. So instead of doing your first procedure on a patient, you've rehearsed it on a mannequin many times, and you learn how to do it in a standard way. And you do it in such a way that once you've met the standard certifications, you're signed off on it and you're considered competent. So that when you go to the patient patient the next time you're able to do that. So I'm looking forward to learning some of the tricks of the trade as is practiced at St. Clair College and across Canada. I think we, as a destination children's hospital at Children's, we have partnered for many years with our folks in Windsor when patients need high-end care, things like ECMO, and which is an ICU type heart-lung bypass type of support system for patients with severe pneumonia or congenital problems, infant cooling, the babies that we do all those sort of things at our hospital. So we've always worked collaboratively clinically, but I think on the educational front, there's going to be lots to learn, and I'm looking forward to this day.
Good, and I am too. I'm honored to be part of a panel about what our foundation is trying to do as it relates to patient safety and some of the things that we're trying to get involved in as well. And so, lastly, I wanted to ask you what's happening new or maybe not so new at Children's Hospital of Michigan. I know that I've talked about the new tower, the new lobby, and it's very exciting for people to see it for the first time. We the foundation, had a little involvement through the interactive wall that is in the lobby, and every time I'm over there, it's so much fun to see the kids playing with the wall and just having a great time. And once they walk in, it doesn't feel like a hospital. It feels like almost like a airport or something. And so what other things are happening at the great Children's Hospital of Michigan?
Well, I think you captured a lot of it. I think, as you say, it almost feels like you're going into almost like a theme park when you walk in there. The kids really find it to be a little bit less threatening than ever before. They're excited to be there. I think from an innovation standpoint, one of our leaders in neonatology, Dr. Girija Natarajan, is starting a neonatal neuro NICU. So these are babies. So Wayne State University, Children's Hospital of Michigan have led the cause on brain injury in children. And so we talked about infant cooling a second ago. Infant cooling was started by Dr. Seetha Shankaran at Children's Hospital of Michigan. So she pioneered the work, published in the New England Journal of Medicine a couple of landmark studies. And so we've now, as we advance the neonatal neuro NICU, we're now going to be able to do infant cooling at the site of the hospital. So our Panda unit is going to have on their transport rig, they're going to be able to start the cooling process at the referring hospital. So the patient is already starting to heal as they are on their way to Children's Hospital. That's a breakthrough. We have specially wired rooms so that we can do continuous EEG monitoring. That's like the brainwave scans that you do where you put the little electrodes on the scalp and measure for seizure activity so that you're making sure you're getting a good outcome. So we'll have 4 identified rooms in our NICU, and we just launched this in December, and we've had our first patient in early January. So I think this is a really exciting thing. We've started increased focus on infection prevention. We started a new protocol where you've probably heard of things called MRSA, which is a bad staph infection that patients can get. We started a new protocol in December where we are using an antibiotic ointment into all of our patients in the neonatal intensive care unit and the pediatric intensive care unit, where we give them the antibiotic ointment for 5 days. And what we're trying to do is rid their body of the staph that they probably already carry so that we can reduce infections. So we continue to try to drive safety and innovation, and these are just a couple of things we've been working on.
Well, it's such a special place. And on a lighter side, I know that the patients and visitors now have free parking.
Yes. That is, it's lighter, but we think very, very important. We don't want patients and families to have to make tough decisions about coming to an appointment based on whether or not they pay a few dollars to park. And so we think that this will lower the threshold for patients to come in to see us and increase access to care for patients and families that really need it. So we want to increase our access, and we think this is just one barrier that we're taking down that could have been an impediment.
That is so
we're excited
important
about that.
And that's great news. And so I'm honored to work with you and your colleagues, and I have a great relationship with your CEO, Luann Ewald, was just with her the other day, and so I look forward to our partnership continuing. I look forward to our symposium on February 8th in Windsor, and love to have you back on the show, talk about other great things that you're doing.
Thank you so much, Larry.
Thank you very much. That's Dr. Rudy Valentini, Chief Medical Officer at the Detroit Medical Center, and also Chief Medical Officer and Pediatric Nephrologist at the fabulous Children's Hospital of Michigan. So coming up next, what I'm going to do is introduce you to this month's Northwestern Mutual Little Champion. and provide an update on some new foundation activities, and it's all coming up right here on the great voice of the Great Lakes, News Talk 760 WJR.
It's Caring for Kids with Larry Burns.
Welcome back, everyone. I think we had a great show tonight with our three guests in the studio. It's always nice to have people in the studio. And I'm looking forward to this symposium on February 8th in Windsor. But right now, this portion of Caring for Kids is dedicated to highlighting a Little Champion. And it's sponsored by Northwestern Mutual. The Little Champion program honors children who have overcome major obstacles in their young lives and continue to tackle those challenges with a smile each and every day. This month's Little Champion is 3-year-old Matthew from Grosse Pointe Park, Michigan. Matthew was diagnosed last December with a rare condition called AML, a cancer of the blood and bone marrow. Matthew underwent intense chemotherapy and spent 145 days in the hospital. But despite such difficult circumstances, Matthew's resilience and heart of a champion has kept him fighting and doing so with a smile. Congratulations, Matthew, this month's Little Champion. For more information on the Little Champion program and how you can nominate a child, visit chnfoundation.org with a /champion. A couple foundation updates. The tickets are still available for the International Patient Safety Symposium. I mentioned several times it's on February 8th at St. Clair College. What I didn't mention is how to get there or how to find out more about it. Visit ipssdetroit-windsor.com. ipssdetroit-windsor.com. And so we also are going to have our very own Youth and Adolescent Mental Health Summit on May 14th at the Inn at St. John's in Plymouth. There's going to be a lot more information about that in coming months, but May 14th, Mental Health Summit that the foundation is putting on along with a bunch of other great partners. And so thanks for joining us tonight on Caring for Kids. The Children's Hospital of Michigan Foundation is proud to sponsor this program, and we hope you enjoyed tonight's episode. For more information about health and wellness for children, join us next time here on the great voice of the Great Lakes, News Talk 760 WJR.
Caring for Kids on WJR has been presented by the Children's Hospital of Michigan Foundation.